Hello, my name is Patricia Palmer, and I am recording for my surgical instruments class. This is the unpacking your mock instruments and flashcards assignment. So here we go. Gloves on. So this is a beaver retractor, and I believe that I think this instrument is used to pull back tissue or organ or something that may be in the way to get into the where the surgeon is trying to get to. So I believe that's what this instrument is used for. Where on the body I feel that this is used, probably the stomach, the bladder, per se, one of the bigger organs. For what kind of surgery, I would believe like bowel surgery, stomach surgery, uterus surgery, rectal surgery, anything particular pertaining to that. Okay. This is a Loma tile clamp, 5-inch non-penetrating. I believe this is used to clamp on to, I will have to say, either veins or tissue or ligaments, probably muscle. This was used to clamp on to things like that. The part of the body that I believe is used for is probably anywhere that muscle or tendons or anything is located. So preferably like the arms, the abdomen, the legs, everywhere in the entire body. This is the Babcock tissue forceps. I believe these are used to clamp onto, again, certain tissues and tendons and things like that to hold in place or to stop bleeding or something like that for the surgeon. I believe that's what these particular forceps are used for. The kind of surgery that I think they'll be used for is preferably probably like heart surgery or lung surgery or something like that. And the part of the body that I believe that it'll be used in is the chest area or neck area. Okay. And this one is called the Russian tissue forceps. I believe this particular item is used to grab onto certain tissues and blood vessels inside of the body. I believe the part of the body that this is mostly used for is probably either the fatty parts or the tissue on our backs or our sides or our abdomen. I believe that is the part of the body that it's used for. And the type of surgery I believe that it's used for is more than likely going to be stomach surgery or bowel surgery or something like that. Next, okay, so I'm gonna put these away. Put these back in the bag. I'll put this away. Now I'm gonna unpack flashcards. Alrighty. Okay. We're going to randomly choose our flashcards. Okay, so we chose this one. We chose this one. We chose this one. And we chose this one. Okay. Okay. So the first one we chose says, okay, so this is the first card that we have. First flashcard, and it says, what are the names of these instruments? I'm not sure what the particular name is, but I'm quite sure that it is some form of retractor. I'm quite sure about that. And what category are these instruments in? It's definitely in the retractor category. So let's see. Flip the card over. Okay, so the answer to the first part of the question was it is a Harrington heart retractor, small and large. So it is a retractor. So we did get that part right. And the category the instrument is in is a handheld retractor, which it is a retractor category. So we partially got that one right. From my first impression of this instrument, basically it looks like a back scratcher to me. Yeah, my first impression is, yeah. But it is interesting to know that this is this particular heart retractor, so it is used for the heart. I guess doing heart surgery, and it is in the category of handheld retractor. So I do learning that it's not just a retractor category; it also is a handheld retractor category. So I'm quite sure that there must be electronic retractor category and things of that nature to let me know that handheld distinguishes the categories of certain instruments. It does seem logical, you know, you do need retractors to separate, to remove other organs and bones and stuff that we do have that protects our heart. So it is a logical instrument. It looks strange, it looks weird, but it looks also convenient to use as well. Like it fits perfectly in the hand, look like. So, yes, that's one. Okay, so this is the next one that we have. This is the next one. And it says, what instrument combination is this? And from what I'm guessing, it is some type of instrument that either sends air or gas or some type of pressure through the machine, and it has to be plugged up and hooked up to something else as well. It says, what procedures would this be used on? I assume this would be used on, I guess, certain stomach procedures or procedures to inflate things in the organs or suction. To suction blood or something like that. I believe that's what this will be used on. So now we're going to find out the answer. It says the answer to what instrument combination is this is a laparoscope with light cord and standard definition camera attached. Okay, so it's a scope camera. What procedures would this be used on is a laparoscopy. So this is a camera, a device that used for a camera to be inserted inside of the body to take pictures or video of certain parts or organs in the body that may need medical attention. So I would think that the parts of the body that this would be used on would be like the intestines, maybe the liver, the kidneys, something like that, to take pictures of and to see inside of the body of certain parts that doesn't, that's not visible on the outside. What kind of surgery? Probably like surgery on the liver, things like that. It says that it's used in laparoscopy, so I'm assuming that a laparoscopy is a type of surgery in itself. So, yeah. My impression of this is actually really cool. It made me think that it was some type of air pressure machine or something like that, but it's actually a camera. So first glances is, fool me. That's my first impression. Had me thinking it was something completely different. So this was interesting. Okay. It does seem logical. It does, to know that they're able to have a camera in something that's so long as this. it does seem like it does get to certain parts of the body that you do need to be able to see. So it does look like it's very useful inside of the OR. Not strange at all. Okay, on to the next card. We have, this is our next card right here. These are the pictures, and the question is, what are the names of these instruments? I'm not sure what the names of these instruments are, but there's some type of instrument with a loop on the end, so I'm assuming that they might be used to cauterize or to cut off molds or something like that. I've seen an instrument like this used to remove molds from the body and ingrown indentations on the skin and things like that. It's a, when are these instruments used? I assume they would be used to do outpatient surgery or just a minor procedure on a patient. What's the function of these instruments? I believe the function is to remove malignants and moles and stains off of the skin. Okay, so let's look at the answers to these questions. It said, what is the name of these instruments? They're uterine curettes. Uterine curettes. When are these instruments used? During a dilation or curette, a DNC. What is the function of these instruments? To scrape the inside of the uterus due to retained contents or excessive bleeding. So these instruments are basically used during after a miscarriage or during the abortion proceedings and things like that. That's what these instruments are used for, to scrape the excess outside of the uterus to get the bad out. So yeah, that's what this is for. First impression, it completely shocked me what it's actually used for and what they actually are called. I did not think that they was used for that in particular at all. So that was a complete shock to me. That's my first impression of that. It does seem logical. I guess you would need, it's the same as what I said before, is to take off, to get off moles and malignants on the skin. It would be the same as this right here, because the loop in the instrument is what allows you to pull things out and pull things away. So yeah, it's a very logical instrument, and it could be very useful in everything that it's used for. It's not strange at all. A little strange, but not strange at all. Instead of having a whole spoon, you just have a spoon with a hole in it. Okay, so this is our next card, our fourth and final card right here. This is the instrument, and I'm going to read the questions now. Say, what is the name of this instrument? It look like tweezers to me, but I know it's some type of forceps or something like that, but it definitely look like tweezers. What structures is this commonly used on? I would say preferably the, I would say probably muscle and tendons and cartilage. I would say that these are the structures that this is commonly used on. So now I'm going to read the answers. It says, what is the name of this instrument? It's an Adson pick up with teeth. An Adson pickup with teeth. What structures is this commonly used on? It's used when closing skin with sutures or with staples. So this is something that is very commonly used when you're getting stitches or staples to close up and end the surgery. So that's what this is. This tool is specifically for. My impression of it is it looks like a basic everyday household item. Like I said, I thought it looked like tweezers to me. So that's my first impression of it, and to see that it's commonly used to close up incisions and to help with administering sutures and staples is very impressive. To see such a small tool be used so often in basically every surgery. And it's very logical. I can't wait to see how it's used and how you're supposed to handle this specific tool to use the staples and close up the body as well. And so it does seem logical, and it's not strange at all, not strange looking at all or anything like that. So yeah. My final thoughts on embarking on this new chapter in my life. This is going to be my 4th or 5th semester. I'm almost complete with this entire degree. I'm excited to finally be hands-on. This is the part that I've been waiting for, to finally be hands-on, have the equipment, have the tools that I would be working with and seeing and touching every day. So I'm very, very excited and ready for that. And yeah, I can't wait to rock this course and knock it out like I have done the rest. So again, my name is Patricia Palmer, and this is my assignment for my surgical instruments class. It is Unit 1 assignment, unpacking your mock instruments and flashcards. Thank you.